Hello, I'm Judy Johnston, Research Instructor in the Department of Preventive Medicine and Public Health, KU School of Medicine, Wichita. Today we're going to talk about policy and program as it relates to congregations. We have several areas that we're going to discuss briefly. First of all, why are we focusing on healthful food as a focus area in healthy congregations programs? And then we're going to get specific and talk more about the differences between programs, practices, policies, and environmental changes, and why we would like you to focus more and more on policy and environment, and yet what the specific role for programs is. And then we're going to give you some examples of some churches that, here in Kansas. So let's start with the why. Why healthful food is a focus area? Well, first of all, faith communities are extremely powerful in their community, both for the people that are members and the people in the community surrounding the congregation. They're looked to as a source for health information. They certainly can be a model for healthful living, and they're often gathering places for health education. Additionally, lots of food is served at congregations. Clergy and congregants eat a lot of meals and snacks in their faith communities, and unfortunately the tradition in churches is that those meals and snacks are not always healthful foods. Also, the faith community leaders, both the clergy and the lay leaders, can really influence the lives of congregants in a number of areas around health and other topics. You know, churches are often the center of communities for people, and as a rule, clergy are very widely respected, so therefore they should be places where healthful eating is taught, is modeled, and is supported. So I started out saying, well, we're going to talk a little bit about program, policy, practice, and so on. And what do we mean by that? When we talk about policy, people tend to assume that that's something that only happens at government. And the reality is policy happens at the organizational level. Policies can support healthy behaviors. They can lead to increased healthful foods and healthful eating by producing changes in the environment in the community or in the congregation. Policies are written rules, and the reason they are important is that by the very fact that it's written down, you have some accountability. You have this in writing, so on a regular basis, someone needs to be looking at it and saying, are we doing what our written policy says? Additionally, written policies provide sustainability. So if, for example, your Healthy Congregations team has some practices they put in place around healthful eating or other health topics, when you move on, you retire from your position as health ministry leaders, or you may leave your congregation and move somewhere else for whatever reason, you're no longer in that position. What happens to those practices if you're not there to be sure that they're put in place? If another leader comes in and it's not important to that leader, it could just be forgotten about. There are also such things as practices, and these are the unwritten policies. And while they may precede a written policy, and they can be incredibly valuable both as a teaching tool and as a precursor to policy, they're not as effective because of that issue of accountability and sustainability. So, for example, again, I'm going to go back to if your team has put in place some activities around offering healthy food at your vacation Bible school, for example. But when someone else is now in charge of the vacation Bible school or is leading your health ministry, if that's not a priority for them, that practice may go to the wayside, where if it's a written policy, it will continue. Faith communities really are not unique in that policies influence culture. And when we talk about culture, we're talking about all the habits and routines and so on that characterize your specific faith community. And if you think about any of the various congregations you may have been involved in or exposed to over your lifetime, you know that each congregation has their own specific culture. And the things that they do, the traditions that they hold, the way they are perceived by their larger community. It also comes back to values and beliefs and attitudes. And so what is done as part of that culture in a faith community is very much tied to their identity and their beliefs. Another way to think about culture is, how are things done around here? What do people traditionally bring to potlucks and snacks? is there a tradition in your congregation of the clergy speaking about healthful eating in messages or sermons or other talks? You know, those are all things that are part of the culture. And so when we talk about policies and practices and environmental changes, we're talking about taking a hard look at your culture and making some intentional changes that will influence the culture. So if a new culture of healthful foods is going to be sustained over time, you need a written policy. Here's an example, and throughout this short talk, you're going to find a number of links to other resources. This one actually comes from North Carolina, familieseatingbetter.org, and it's a great website with lots of resources. But this is an example of a healthful food policy. Effective such and such a date, it is the policy of this faith community to offer healthful food choices, including fruits and vegetables, low-fat milk and dairy products, foods made from whole grains, and water at all meetings, events, and celebrations where food is served. All members share the responsibility for encouraging people to observe this policy. So let's dismantle this a little bit. I like it a lot because it talks about offering healthful foods. It talks about what we're going to do, not what we're not going to do. In other words, it doesn't say we don't allow fried foods or we don't allow sweets. We don't allow. That's not what it talks about. It talks about what is it we're going to offer. And the research really says to us that if healthful food choices are offered and become part of the norm, people will choose those over the less healthy options, and eventually you can just stop offering the others. So you don't need to talk about what you're not going to do. The other thing I really like is this last sentence. All members share the responsibility for encouraging people to observe this policy. So it isn't just the health ministry team, it's everybody. It's the entire church saying this is what we think is important and we all are going to be responsible for it. Now, what that means that you as a health ministry team may need to do some programmatic things to make sure that people have the information and the skills to know how to determine what's healthy, and we'll talk a little bit more about those kind of resources. So formal policies often include a statement of purpose, and when you talk about a policy, it applies to all members. And so formal policies are often preceded by informal policies or practices. So that, for example, I'm going to go back to, what is served after services. And if you've gotten in the habit of always offering fruits and smaller portions of any sweets that you have, and some low-fat or fat-free options, some whole grain options, etc., and those have been well received, then it's time to move to a formal practice or a formal policy. So, offering healthful meals and beverages at meetings and events is a practice, but writing a statement around what will be offered at all meetings and events is a policy. This is a very formal policy. Again, this comes from the North Carolina website that's noted down at the bottom. But again, if you really want to lay out for people the why, because our faith community is concerned about health of our members and guests, because people are more interested in eating smart and moving more, because of these chronic diseases, because fruits and vegetables, whole grains, and so on are healthy and useful in preventing disease. Therefore, it is our policy. And in this case, it's water will be served at all events or meetings, or beverages are served, and pitchers filled with water will be available for refills. Well, another thing that I'm encouraging you to think about as you plan for activities in your health ministry is environmental changes. And what do I mean by that? These are changes to the physical and or social environments of your church. They can provide new or improved supports for healthful behaviors. And environmental changes really are designed to make the healthy choice the easy choice. It's easier to eat healthfully if those foods are in your environment. It's easier to become physically active if that's just the way things are done in your congregation. So we talk about eating as environmental support that supports healthful eating. It makes it easier to find. It makes it easier to prepare and to eat healthier meals and snacks. So again, this may come down to making the foods available at all, healthful foods available of all of the food offerings and events in your congregation. One example of an environmental change that I really encourage you to think about if your church has any grounds of any size at all, and that is community gardening. And the Big Garden community gardening is a great initiative. It was originally funded by USDA and in Nebraska, and then in Kansas it's been funded by the United Methodist Health Ministry Fund. And what it is, it's an environmental change to the physical environment that provides opportunities for increased access to healthful foods at the same time as it provides opportunities for physical activity. I know we have at least one congregation, we have a number of congregations that are doing community gardens, but we have one that actually requires people to tithe back a percentage of the produce that is developed or is raised in their community gardens to help develop and support their food bank so that there's fresh produce. This is one of those opportunities that has been open to congregations in Kansas, and there has been a special opportunity for additional funding. It may be repeated, so keep your eyes open and your ears open for another possible special opportunity for additional funding beyond your Healthy Congregations money. Another idea, and this again comes from the North Carolina website, is to think about having a farmer's market at your church. You know, if it's, again, making it the easy choice. If you came out of church on Sunday or you came out of an event and there is a farmer's market right there instead of a bake sale, you're much more likely to buy that fresh produce. So again, thinking about easy availability, affordability, supporting local farmers in your area, or even people with big gardens right in your church. I have a couple of congregations that actually do it like a produce exchange in the summertime, so that they bring their excess and people kind of pick and choose and say, you know, I grew extra cucumbers, but my tomatoes aren't doing real well, I'm going to swap you. So, you know, thinking about having a farmer's market, finding those resources in your community. Are there local farmers who would be willing to come and have several vendors available? You know, and again, why not tie the community garden to your local farmer's market? Why couldn't you take a percentage of what is grown in the community garden and actually sell it at the farmer's market? There's a lot of resources out there for food policy and environmental changes, and so I'm just going to give you a few of them. This first one is Live Well Alaska, and there are some great guidelines about vending. So if you have vending machines in your faith community, there are some great ideas for some policies around what is available in vending and how they're arranged and so on. You don't need to start from scratch, so they have great things for you. This next one is another really nice one that's designed for faith communities, and it really talks about all kinds of things, and you see the list here. You know, faith community is community space, fresh fruits and vegetables and community gardening, gleaning, gathering unused food in the community and redistributing it. There's a wellness policy template, and there's some tips. This is really a very terrific website. Here's another one that is a government website that they've put together a lot of resources, and it's actually a clearinghouse of best practices. And again, this is both physical activity and food, but it has lots of resources. There are some community practices, there's some curricula, all kinds of ideas, and they're organized by categories, so you could go into this website and then look for healthy eating or access to healthy, affordable food or physical activity or whatever. Great resources. This is a prayer from Reverend Drew Scott, who's a pastor at a church in Turner Station, Maryland, that I really like when we think about food and social justice and environmental concerns. And it goes like this: I thank God for dirty dishes. They have a lot to tell. While others are going hungry, we're doing pretty well. With food and faith and fellowship, we shouldn't want to fuss, because by this stack of evidence, you've been mighty good to us. A lot of times when we talk about food policy or food environmental changes, we forget to think about the sustainable food system, to think about environment, social justice issues. This is a really terrific website. It's tied to the Johns Hopkins Medical Center, but they really have a great set of resources, and their whole mission is to promote a just, healthy, and trustworthy food system in the Baltimore area. But again, they have a lot of materials that are free. There's a Good Food Toolkit. There's a Growing Faith in Food, a summer camp curriculum for kids aged 5 to 11, and other resources. We have another terrific resource that is new, and this is available on the Healthy Congregations website, and this is Pass on PoP Soda-Free Sundays. The focus is on sugar-sweetened drinks as opposed to other kinds of sweet things, and I'm sure some of you were saying, well, why are you picking on sugar-sweetened drinks? Well, because there's a lot of calories in sugar-sweetened drinks, and so there's a lot of calories, and yet you don't get a lot of satisfaction from beverages. So lots of calories without any benefit, and there's certainly no nutritional value. Additionally, both regular and diet soda can make you crave more sweet foods, and so our recommendation is that you really eliminate both. Well, why Sunday? Well, the notion is if you start small, take one small step at a time, and we all have this tendency to try to do everything at once and to change everything, and the reality is that all of the research says take one small step. And so doing it once a week is an easy way to begin improving overall health, and you may discover, well, yeah, I can give up PoP on Sunday. You know, that wasn't so bad. Maybe I can do it twice a week or 3 days a week, until eventually you might decide to skip it completely. This initiative is sponsored by the Kansas Action for Children, and they've put together the great resources that are available for you, the Kansas Health Foundation, the United Methodist Health Ministry Fund, and some other partners. What you're going to find on the toolkit that is available online is a training video with narrated slides for faith communities, so you could take that and use it to train yourself or to use it to show to groups in your congregants. There's the slide presentation if you want to narrate it yourself. There's a frequently asked questions sheet, and then there are 3 toolkits, one for congregations, one for families, and one for individuals. This is already available on the Healthy Congregations website. Great resources. So I've been focusing on policy, practices leading to policy, and environmental change. So am I saying we shouldn't do programs? No. Programs are important at the individual level. So if I am teaching programs, they're usually geared toward increasing knowledge and skills, changing attitudes, providing social support for individuals to change a specific behavior. And they actually can be used to build the basis for environment and policy change. The problem is knowledge by itself never changes behavior. Programs are focused on knowledge, attitude, and skills. So while they may be a beginning point, they're not enough. Again, if you think back to the policy that I talked about, the very first policy about offering healthful foods, you want to be sure that people in your congregation know what that means, and they know how to choose and prepare those. And so it may mean that you need to work with the Extension Office and come up with some programming around that. And there are some other resources I'll tell you about now. We do have program electives that will be available soon. These are things unlike the core courses where you have to schedule and come live to those, and I work with you in your groups in a live format. The electives are out there for you to pull down anytime you want or need them. There is a narrated slide presentation similar to what you're viewing right now. The slide set itself will be available without the narration. There is a discussion guide and then other materials as appropriate. So you can pull those down and use them as you need them. By April 15th, we will have recorded 28 food-centered programs. These are arranged by meals. They have a narrated slide presentation, a discussion guide. Most of them have additional handouts, and many of them have easy, inexpensive, tested healthy recipes. These are recipes from my files, and these have been used and tested by a lot of different people. We have part of these recorded. We're in the process of recording the remainder, and you will have them all by April 15th. By June 1st, We will have completely revised all of the original electives that we had prepared. There are a lot of things that we developed several years back, and when we got ready to record them so they could be used in this kind of a format, we felt like they just needed to be updated. So we are in the process of doing that. And again, these will have all that you need, so you'll be able to simply download and print handouts. You'll have the slides to use, the narrated slides, so you can either just show the narrated slides or use them on your own. So what's happening with our Healthy Congregations churches? Are some of them making this move toward environment and policy change? So I'm going to just pick out 3. There are lots more of you that could have been included. These are 3 that I thought were interesting. We're going to talk about Columbus, Nickerson, and Emporia first. So first of all, Columbus, just to give you some geography, is located in southeast Kansas. It's one of the poorest counties in Kansas, Cherokee County. It's right very near Pittsburgh, which is a different county, but they're, again, very, very poor. 21.1% of everybody in Cherokee County lives below the poverty line, and 28.2% of children live below the poverty line in 2010. And as the team leader, Teresa Amos, put it, because of these economic conditions, a lot of the kids don't learn healthful eating habits at home. So what have they done? At the individual level, they've tried to educate families about healthful eating, and they found that just making recipes available really was not a good use of resources. People didn't use them. They picked them up and dropped them, that kind of thing. So they decided to move toward environment and policy changes, and that has shown to be effective. So they have a practice, it's an informal policy, that they will provide healthful food choices at all church functions. They usually have more than one healthful choice, and then and the Healthy Congregations team members provide the healthy item or items. Congregants with diabetes often also provide desserts made with Splenda. They evaluate this practice by monitoring the intake of the healthful choices. So they really observe people and kind of just do a count of how many portions are taken. And they have found that 35 to 50% of their attendees take the healthful choice. So this is great data as they move toward policy. They also have another practice, informal policy, that they're going to provide healthful food choices at Vacation Bible School. And the person who's in charge of the light supper that's served at Vacation Bible School works with the Healthy Congregations team members to plan the meals for kids. Their focus is on fruits and vegetables and no fried foods. In 2013, they monitored what the kids actually ate, and they found out 25% of the kids ate vegetables and 40% of them ate fruit. And again, thinking about this population, some of these kids probably had never seen fruits and vegetables before, fresh fruits and vegetables in particular. So they're considering some additional policy changes or practice changes in 2014. They're going to start providing only water and 100% juice as the beverages at Vacation Bible School. They're eliminating the Kool-Aid type beverages, those sugar-sweetened beverages. They're not going to provide artificial sweeteners to the kids. They're only going to offer the 100% juice and water. They're thinking about making some of those other practices that have already proven successful into formal written policies so that they will continue over time, so that the accountability factor is there. They have a new pastor, so they need the support of their new pastor, and they realize that there may need to be some additional education among the congregation members in terms of skill development and so on. A second church is Nickerson. This is a small community in Reno County near Hutchinson in south central Kansas. Their population is about 1,000. It's a small community. Again, fairly high poverty level, 23.1% below the poverty line in 2009. And 6.6% of the residents had income below 50% of poverty in 2009, so we're talking pretty extreme poverty. Their team leader is Kathy Kittle. She tells me that their weekly attendance is 60 to 70, so it's a relatively small church, but they've done some really neat things. And one of the things that I thought was terrific was their Wednesday night fellowship dinner, which used to be called, and it's still technically called, the fried chicken dinner. excuse me, members of the community will be nourished physically, spiritually, socially, and emotionally through food and fellowship is the desired outcome. And this is great because it says right up front, this is a food activity, but it's more than that. They provide a weekly meal, short worship, and occasional programs for members of the community and the congregants. So it's not just the people who belong to the church, but it's open to the broader community. They get 70 to 90 people, realizing, again, this is a community of about 1,000 people. They used to serve fried chicken every week, but there's more. Recently, there's a practice, which is an informal policy, among some who provide the meals to focus on including healthful foods. And I put it as by some because different groups provide the meals on different weeks. So even the youth group. So they've been increasing the amount of fruits and vegetables offered. They've started offering water as a beverage. People can bring a covered dish if they want to, and there is a free will donation accepted. And then the programs are on a variety of topics. So it's spiritual, it's mental, emotional, it's social, and it's certainly physical. So they have set some precedent here. They've been increasing fruits and vegetables. They started offering water. This is a practice, and they could consider then going to policy. They also do a monthly cookie Sunday gathering for homemade cookies and fellowship, and they have started offering fresh vegetables, fruit, cheese, and crackers in addition to the cookies. So you get the social of making cookies together, and because there are other foods offered, people are probably far less likely to eat 6 cookies because they have these other options as well. And again, beverages include water at this event and all their events. So again, they may be ready to be moving toward written policy to where the food served at all events will be helpful, the water as a beverage at all events, and possibly not offering healthy foods as an option, but saying, this is the only choice. We're only going to offer helpful options. And again, these are things that need to be decided by the group as a whole with the support from the pastor. And you may be saying, well, Judy, why would you do that? Isn't it good enough that we offer the healthy choices? And I guess I want we to think about, are the foods we eat and share within our religious institutions or organizations in line with the values we hold? So if we say our bodies are God's temple, and then the only foods that are offered, or a lot of the foods that are offered, are high in fat, high in sodium, high in sugar, and have little nutritional value, what is that saying? Does it really support our beliefs and values? I also think we want to make sure that when we're providing food for the less fortunate, whether it's through our food pantry or through meals provided to the larger congregation or the larger community, it makes a difference what it is. We need to be sure that we're giving them the highest quality in terms of healthfulness that we possibly can. So while economics are a factor, we also need to think about how do we make it the healthiest choice we can, because it may be the only healthful meal they receive. When you move to written policy, it assures that accountability. It assures that at some point, on a regular basis, somebody is looking at that and saying, okay, how do our menus stack up? Are they healthful options? Are we doing the best we can for the people we serve? So, this is another policy that's being considered. If you look at this is the exact same policy I used as an example earlier. A third church that has a rather unique initiative is in Lyon County. This is Emporia First United Methodist. The Lyon County is in the Flint Hills between Wichita and Topeka near Emporia, or at Emporia. The city is about 25,000 people. About 12% of families and 22.2% of the population were below the poverty line in 2010. So again, about a fifth or more of the population lives in poverty. Their team leader is Pat Mays, and they have done some pretty creative things. They have what they call their Dinner Crew UMW Circle, and the outcomes that they have set for Dinner Crew is to increase the number of healthy meals served to families with working mothers, to increase the time spent on Christian-based social interaction and learning among young mothers, and to increase the opportunities for emotional support and participation in mission projects within the church, the community, and beyond through active involvement in UMW. So what did they do? This is so neat. The participants in this UMW circle are younger mothers who prepare and meet together and prepare Healthful Family main course to take home. And they prepare them during the UMW meetings and then place them in the oven, and they cook while they have devotion time in the meeting. So they meet after work. All of the ingredients and the recipes for Healthful main courses are there. If there's a skill that needs to be taught, they do some training at the same time. You know, if they aren't familiar with a vegetable or how to prepare it, or there's a technique they're not familiar with, because there are a lot of young people who have never been taught to cook. So this allows them to build skills, allows them to build confidence. They put together these casseroles in a social support system. They go into the oven, there's a short devotion, and then they have the UMW meeting so they can be involved in their goals and activities, and when the meeting is over, they take the casserole home and feed their family. The ladies only pay $10 a month. It covers the cost of the food, and if there's any shortage in that, the Healthy Congregations Program grant pays for that. Pat tells us that they've seen an increased change in knowledge and skill at the individual level, much more social support at the interpersonal level, that, you know, people are getting to know one another. These are moms that maybe the Emporia First group only saw at services on Sunday, and now they're involved and engaged in UMW. So there was an environmental change. They had to move the meetings so that they could be done adjoining the church kitchen and the meeting space there. So they had to move out of their usual space. That was an environmental change. But that they also made some policy changes. They revised the time for that circle, and they actually revised the format. So they created this new circle and changed some things to meet the specific needs of the group that provided social support as well as physical, mental, emotional, and spiritual. So those are some great examples of some neat things that are happening in Kansas, and I could talk for another 30 minutes about some of the things the rest of you are doing. But so what is the bottom line here? The desired outcome is to improve the health of the community. Healthful food initiatives need to be multidimensional. They should probably include some individual level skill, knowledge, and attitude through programs, but at the interpersonal level through social support modeling, and at the organizational level, which is environmental change and policy, that's when you really see significant changes and you see sustainable changes. Congregations can start small and add components as they grow. So increase awareness initially. You know, why would we do this? You know, why are the healthful foods even, you know, being considered, you know, and then look at the practices, those informal policies. Start introducing the healthful foods as an option, and then model practices to where when the health ministry team sponsors something, it's only healthful foods, it's not choices. And then ultimately move toward a written policy, keeping in mind that a written policy assures accountability and sustainability. So I encourage you to think about the practices you currently have in place and think about how do you move on to make these permanent through policy and environmental changes. Thanks.